Over the years, the government is going to change or refocus how they're going to investigate white collar crime and management government investigations. Welcome, everyone. My name is Justin Paperny with Prison Professors. Thank you very much for taking the time to listen or watch. If you're watching this on our YouTube channel or choosing to listen to our Prison Professors podcast, we want to educate you and help you understand the focus that government investigators are pursuing right now, specifically healthcare fraud. And there's been a big change over the years. There's only so much crime the government can investigate, and they're going to reprioritize. When I came home from prison in 2009, in the Bernie Madoff era, so many of the initial prosecutions were Ponzi schemes, money managers raising money and then stealing the money to enrich themselves. It was the focus for many, many years. And then in 10, 11, 12, 13, we got into the mortgage meltdown and the crises. And many of our clients at Prison Professors or people who were reaching out to us were accused of defrauding banks and purchasing buildings by virtue of lying on the loans because the market imploded and they could no longer support the asset. And banks came in and said they were defrauded. So it's this evolution of white collar crime. For the last few years, a heavy, significant focus has been on healthcare fraud. And I would argue that there's always been a focus of healthcare fraud, of course, and holding doctors and people who break the law accountable. That has never not existed. But it's really been a priority over the last few years, probably starting when then Attorney General Jeff Sessions really made that a priority and focus of the Trump administration. And it's only picked up since then. So the focus of this video or podcast is going to focus, I'm going to address a recent $150 million healthcare fraud, how it happened, the consequences, and then close with some takeaways on how to manage a government investigation. And whether it's healthcare fraud or mortgage fraud or securities fraud or corruption, these takeaways really apply to any sort of case. I encourage you to read the full blog, to get access to a number of our free resources, to visit prisonprofessors.com to get an access to a copy of Earning Freedom written by Michael Santos. We have scores of blogs and videos and podcasts that will help you, whether you're managing an investigation, about to go to prison, you have a loved one in prison, how to work with a lawyer. So I encourage you to invest the time to visit Prison Professors. Now, let's transition specifically to this video or podcast on healthcare fraud and what exactly that means. Well, naturally, the government is making a very big focus on managing government investigations, specifically opioid prescription abuses, unnecessary billing. It costs taxpayers hundreds and hundreds of millions of dollars, though you may not see it as a taxpayer because it goes into this dark hole. I'm like, I don't know if I'm a victim. I don't know what it costs me. It does cost you. It costs everyone by way of rising costs, a lack of trust in the community. Doctors frequently will get much longer sentences because the judge will tell them you had a position of trust as a doctor, someone who held a license, esteemed in your community. You were in a higher position of trust. So there's going to be a higher level of scrutiny and punishment for breaking the law. These are things you need to keep in mind. As I mentioned earlier, government is really prioritizing resources in healthcare investigations. And I'm going to cover in this a recent case involving 21 defendants, 12 doctors, and $150 million fraud. Let's go through the background a little bit to get an idea of how significant and severe this problem is, which points to why the government is applying so many resources to healthcare investigations. According to the National Institute of Drug Abuse, nearly 50,000 Americans die every single year due to an opioid addiction. Physicians and other medical professionals write and fill prescriptions every single day. But in recent years, there have been some really high publicized cases. I can think of the Insys Pharmaceutical case out of Boston. That was once a billion-dollar company that was publicly traded. Company's now bankrupt. All the executives went to prison. It was the over-prescribing or offering kickbacks or incentives to doctors to prescribe a fentanyl spray. And fentanyl, of course, is, from what I've read and heard, the deadliest drug there is, significantly worse than cocaine or heroin. So there's a number of these cases to draw from, not just this $150 million one that got more than 20 people indicted. The Department of Health and Human Services Medicare Fraud Strike Task Force investigates healthcare fraud. In 2018, based on the task force's work, criminal charges came down against medical professionals from the Tri-County Wellness Group in Michigan and Ohio. The case revealed a brazen scheme that went on for many, many years. The scheme involved doctors prescribing massive amounts of opioids to patients and also seeking fraudulent reimbursements from Medicare. In the end, Tri-County filed about $6.6 million in reimbursement claims. None were valid because they were all deemed medically unnecessary. Something to keep in mind when dealing with a white-collar crime or a government investigation that I covered and touched on in this paragraph is how long the fraud actually went on. A mitigation strategy that lawyers or defendants will often use is it was a short window. It happened one time, two times, or three times. It was a crime of opportunity. It was impulsive. I didn't fully think it through, but it's not a full part of my character. It's not something that's persisted for many, many years. So when you hear something like a scheme lasted many years, it's hard to use as a mitigation strategy. This is out of character for the defendant. The government or the judge may argue this is very much in your character to cheat because it went on for so many years. Recently, a defendant in a very, very large mortgage fraud case got a very long sentence, in part because the loss amount was so long, but the judge said, you did this for 20 years. You know no other way than to cheat. I don't know if you've ever done it honestly. So the intent, the length, all of these things matter, which speaks to if unfortunately you've done something or you've been caught up in a government investigation, the length matters, but how you respond to it matters. What happens when you're in trouble matters. I read the unfortunate case this morning of a physician in Connecticut who was rearrested for, as the government alleges, trying to hire a potential hitman to take out a co-defendant. You have someone looking at 2 or 3 years potentially in a minimum security camp, now looking at decades in prison in a medium security prison. So if you have unfortunately become embroiled in a government investigation, the first thing you must do is not make matters worse. You've got to stop the bleeding, and that includes working honestly and openly with counsel and anyone who is part of your team. Denial, as they say, is not just a river in Egypt. It leads a lot of people to trouble and longer prison terms. Let's transition to the discussion as written on this blog. Again, you can get access to the full blog and other resources at prisonprofessors.com. In this case, Mr. Rashid was the owner and CEO of Tri-County. This company operated healthcare facilities, pain clinics, and labs in Michigan and Ohio. As CEO from 2008 to 2016, again, a very long window, Rashid oversaw Tri-County's regular policy to offer patients prescriptions of OxyContin in exchange for accepting unnecessary and excruciating back injections. The unnecessary injections totaled more than 6.6 million doses. That's a lot. And when you have someone who owns a company of this size, who's probably charismatic, who is a good marketer, making a lot of money, it is then easy to entice and sweep people into this who never in a million years would have imagined they'd become part of such large deception and fraud, $150 million fraud that hurt people, potentially killed people, and exposes them to many years inside of a federal prison. The Department of Justice in a statement said, the specific injections used had nothing to do with the medical needs of the patients, but were instead selected to be administered because they were the highest pain injection procedures. According to the DOJ, Tri-County physicians administered pain injections to patients based exclusively on reimbursement rates. In other words, you don't need this. That's okay. We're going to give it to you because it's going to get us the most amount of money. That's in layman terms what the government alleges happened. The evidence showed that Rashid even offered certain physicians a share of the Medicare reimbursements that could generate and encourage them. It could generate more revenues, encourage them to do more. So what you have is someone like Rashid, who is a slick, smooth salesman who understands the pressures that people may face. Would you like to make more money? Do you like where you live? Would you like to live in a better home? What's it like to work 80 hours a week without a raise? What's it like to be a slave to patients? These are things that I've heard people say over the years to leverage off and to get people's buy-in, right? So good salesmen or charlatans are going to find your weak point. They're going to find a pressure point. And this person found the pressure point by encouraging doctors to cheat, by incentivizing them, and then really even encouraging them even further by offering a portion of the Medicare reimbursements. And that's how things go from bad, to terrible. It takes resolve. It takes discipline to say, no, I don't want to work with you. You're a criminal. I went to medical school. I've worked very long and hard to get here. I don't want to throw it down the drain. I don't want to flush my life away and go to prison and potentially hurt and kill people and ruin my family as well. It takes a lot of resolve to say no. And also the expertise, the intellect as an executive, as a business person, to know when you're being exploited, to know when someone may be taking advantage of you. Indeed, many of the people who become immersed in the system say the same thing. I didn't have bad intentions. I didn't go to medical school with the idea that I'm going to defraud Medicare of 150 million bucks. It doesn't work that way. But if you're not aware of your tendencies, now people could be exploiting you, you are going to be in some trouble. Continuing through this blog, while some patients who visited the Tri-County clinics were legitimately suffering from pain, scores of others were drug dealers and opiates. In fact, I remember reading that many of the patients were living in homeless shelters, which was a clear red flag. Even though some physicians at Tri-County claimed to be unaware of what was going on, the evidence presented at trial showed that Rashid would only hire physicians who were willing to go along with the scheme. That evidence helped convict at least 12 Tri-County doctors. So a lot of these doctors went to trial, claimed a sense of willful blindness or ignorance. I didn't know, I didn't understand it. I was doing what I thought that I was doing. This was brought to me. It wasn't my idea. I was prescribing things that I think were normal and right for the patient. And unfortunately, the jury saw it differently. And the consequences, of course, of going to trial are significantly severe. Right? You have the right to go to trial. You also, if you lose, have the right to get a significantly longer prison term, which is absolutely going to be the case. Recently, a client of ours was sentenced to 47 months in prison. Had he taken a plea agreement, it probably would have been at worst 6 months or 12 months in prison. So these doctors had the right to go to trial to try to prove their innocence. The judge has the right to equally punish them with a longer prison term, because the judge would then say you're unrepentant, you're not sorry, you knew better, and you have not accepted any responsibility. You are demonstrating no remorse. And of course, that's when sentencing goes bad and you get really punished. The Department of Justice also gathered evidence to show that Tri-County intentionally targeted the Medicare reimbursement program. The scheme, of course, was successful for a while. The government showed that Tri-County received more money for opioid injections than any other medical clinic in the United States. When at one point Medicare suspended the privileges of Rashid's pain clinics, Rashid then created new shell companies and enrolled them with Medicare. If you're inventive, if you're creative enough, and you're used to breaking the law and finding loopholes, it's simply going to continue. So he continued the scheme using shell companies to launder the income. As a result of this investigation and DOJ prosecution, Rashid pleaded guilty to one count of conspiracy to commit healthcare fraud, one count of money laundering. 21 others, including 12 physicians, are already convicted in connection with this case. Something that's interesting before I get into the sanction for Rashid, and I know those of you watching on YouTube are able to see this blog. If you're listening on our Prison Professors podcast while driving in your car, bear with me for a moment. Even though Rashid was the organizer and orchestrator of this, and arguably the most culpable, he could be positioned to get a better outcome than people who went to trial, people who didn't accept responsibility. So by virtue of him pleading guilty, and he received a 15-year prison sentence and a $50 million restitution order and forfeiting assets that he had in commercial and residential real estate, by virtue of him cooperating and pleading guilty as the organizer, he could be in a position to get a better sentence than doctors who he brought into this, and I would argue exploited throughout this situation. As aforementioned, current trends, this investigation is consistent with where the Department of Justice is prioritizing healthcare fraud. Indeed, Greenberg-Torag included unnecessary medical services and opioid prescriptions in its 202 outlook for healthcare enforcement trends. This is where a lot of money is being applied. I mentioned earlier, 50,000 people a year dying of this opioid pandemic, and it has to be addressed. And the way they're going to do that is by taking down these companies and giving significant, really significant prison terms. And it's going to continue, especially as these cheap drugs make their way into this country and people struggle to manage their addictions. I want to close with some takeaways that will help all of you manage a healthcare investigation, mortgage fraud, any type of investigation. It's something that you should understand. One, the government has essentially they have all the assets in the world. They have our tax dollars. So while they only have so much human capital and resources they may to apply to a case, if they have interest in an industry or fraud, they're going to pursue it to all end. So many tools and resources to investigate. And they'll investigate as long as they need to ensure they're ferreting out fraud and sending people to prison. If there is any time to be thorough and deliberate and ethical and honest in the healthcare industry, this is the time. You need to better understand the consequences of cheating, which is why I encourage you to go to Prison Professors to learn more and read other articles. And as I said, if unfortunately you're immersed in the system, your post-defense conduct, what you do moving forward matters. From the Department of Justice perspectives, one of the best tools against doctors and medical professionals who abuse the system is criminal prosecution, right? That's why they're going to indict you, they're going to send you to prison, and they're going to issue all of these scathing press releases all over the internet that show people what happens when you cheat. It would be foolish and naive to not be aware of the resources the government has and to the degree that they will go to prosecute and put people in prison. Something that's helping ferret out fraud, something the government is really pushing towards as we go through these takeaways. Number 3 is having insiders in the healthcare industry file whistleblower complaints, filing them with the Department of Justice. And under the FCA, whistleblowers can receive significant monetary incentives to come forward and expose what they know. That's in all industries. It's in the healthcare industry that it can happen. They're in the securities industry. I've seen some people come into tens of millions of dollars by whistleblowing, but the government is going to encourage people to come forward and reward them because it's often not easy being a whistleblower. There's a great line by a famed professor, Warren Bennis from USC, who unfortunately passed away recently. In one of his books called On Leadership, Dr. Bennis said, it's great to whistleblow, just make sure you have another job lined up. So whistleblowing on paper sounds great, though in reality, there can be repercussions, which is part of the reason the government is incentivizing whistleblowers to come forward, to come clean, and offer as much protections as they can. Additionally, the government will also I don't want to say overcharge. They will bring in as many charges as they can to get a lengthy prison term. So takeaway number 4, the government may include money laundering charges in healthcare cases, as they did in the Tri-County case. And number 5, the government charged and convicted doctors who claimed to be unaware of the Medicare fraud scheme at Tri-County. And as the Tri-County case shows, sentences in healthcare fraud cases can be severe. Medical professionals must be proactive and seek help if they become suspicious of any wrongdoing. So that speaks to the sanctions right now and how long these sentences are, but also the idea that you're unaware of what's going on around you. If you derive a penny, just a penny from what people around you are doing, you're culpable. You're going to be held accountable. And these doctors who claimed, essentially, I didn't know, I'm turning the other way, I didn't understand what was going on. It's not an adequate defense, unfortunately, for them, as the government so easily proved. To conclude, the DOJ continues to investigate 2 types of healthcare fraud: billing unnecessary medical services and opioid prescription abuses. Many people are serving lengthy prison sentences for billing unnecessary services to government healthcare programs, and I can assure you more investigations are in the pipeline. Thank you so much for watching this video or listening to the podcast. I encourage all of you again to go to prisonprofessors.com to learn more about government investigations and ways that your company can successfully manage a government investigation, or if you are unfortunately immersed in this system, steps you can put in place to not just get the best sentence, but come home strong and ready. Again, I'm Justin Paperny with Prison Professors. Thank you very much for your attention and time. Goodbye.